Swayam Prabha. Digital India. Educated India.
Welcome to the course Environmental Impact Assessment, and in today's class we are going to cover methods for health impact assessment under the larger ambit of methods under EIA. So for this particular session we are referring to chapter 16 of the book Methods of Environmental and Social Impact Assessment by Ricky Thirlwell and Graham Wood. And accordingly, our coverage will include that we're going to look at the concerns related with human health risk assessments. And then we'll look at key definitions and concepts involved in this. How do we understand the overall concept about health? And then we'll look at how one undertakes EIA in this particular domain and how it overlaps and integrates with the other domain of EIA. Then we will look at various other concepts which are involved, like where do you really perform the study? So the concept of inside fence and outside the fence. And then we'll look at different stages of EIA pertaining to health. So the screening and scoping, and then how do we undertake assessment for health, and then what are the mitigation measures, and then the human health risk assessments, how do we undertake that? So accordingly, the learning outcome, expected learning outcome after completion of this particular session is that you should be able to review and discuss the changing perspective in human health risk assessments. And then you should be able to define and conceptually explain various terms used and concepts used. And then you should be able to also make judgment how you have to go about this particular domain, and then related with decision making about whom to engage, and then where all the study has to be conducted. Then also your ability to decide what will be done in the screening stage, scoping stage, and what kind of methods are available to you for the assessment of health, as well as what steps are taken for mitigation purpose, and then you'll be able to tell the key aspects of human health risk assessment. So looking at the concepts of human health risk assessments, so wherever you'll see in practice, whenever we do it concerning EIA, physical aspects are given much more significance, even though they are indirectly connected with health. So wherever the impact is concerned, you will look at what really happens to the physical health about the environment. So you see that initially the emphasis was more on the physical aspect of the environment, but later we see that the concern shifted towards the socio-economic, institutional, and other aspects of health, also determinants also in the area of health impact assessment. If you see that we have in the beginning of the class, we had seen all the timelines when we covered NEPA and everything. So the initial emphasis was on the health. When the environmental risk aspect came up, we were more concerned about what threat it has on the human health. But in practice, more emphasis was actually to the physical part of the environment, and less was really concerned about the health. Though there's another perspective which says that if one takes care of the environment, it would really take care of the health. But health is said to be a significant part of EIA. We see that irrespective how this entire EIA came up, still biophysical has more emphasis in the EIA process, and we see that it is indirectly contributing towards the health benefits. So we say that it was in 1970s and 80s there were certain health disasters, like you can see Love Canal and Bhopal gas tragedy, that public health was given attention. So it was that time that public health had got weightage. So from then, our exposure, we started looking at what kind of exposure we have to the toxic chemicals whenever the development is happening, and what kind of development is happening and what kind of exposure will happen. So I've given you the link to the documentary movies which you can see pertaining to this, to the about the Love Canal project. Then you can also look at the Bhopal gas tragedy. So it was this time with this incidences that we actually started to focus on the health aspect in EIA. So initial tool for assessments we see in human health risk assessments, HHRA, within EIA framework. This helps us to evaluate various health hazards, what kind of health hazards are there. So human health risk assessment, this would, when you do undertake health assessment, it will tell you the likelihood of whatever exposure is happening to you, series of exposure, and what kind of damage it is doing to you already or is likely to do on individual's health. So that is what is done in human health risk assessment. And human risk assessment is said to be a process where you estimate the kind of impact which will happen, the nature of impact. Then you also look at the probability of that impact. So what nature of impact will happen and what is the probability that that impact would happen on your health. And especially when we are dealing with human health risk assessments, it is confined, more focused on chemicals, contaminant in the environmental media. So broadly speaking, human health risk assessment has 4 steps, which begins with planning. So here you have step 1 where you have hazard identification. You try to find out what hazard is there. Then you also look at step 2, dose response assessment. So you see that what kind of, for what dosage, what kind of response happens from the human receivers. And then you undertake exposure assessment, to what exposure, what kind of impact will happen, and then you categorize all the risk. So that is what you do here. These are the key 4 steps you see. And we also find, like apart from this human health risk assessments, you also find health impact assessment, HIA tool, which is developed by WHO, and it is from the perspective of health assessment. So health impact assessment, HIA, is said to be a practical approach, and where you judge the potential health effects of not only just the chemicals, but about the policies, programs, or the project, what kind of impact it will have on the people, and especially on the vulnerable or the disadvantaged groups. So that is what health impact assessment tool by WHO helps you to look into. So in this image, you can see graphical presentation of the tool. You can see different phases of process, steps, questions to be asked, and actions to be taken. So you can see here, like, what are the steps of health impact assessment. It's very, very similar what you see: screening, scoping, appraisal, reporting, and monitoring when you take health impact assessment. And you see the phases which you have, like at the policy program level, stakeholders participation, and policy implementation. And then what kind of steps are taken and what kind of questions are reviewed within this. So who should carry out screening, how to carry out screening, and then questions are like in the scoping stage, what is the geographical boundary of a health impact assessment? What is the timeline for health impact assessment? What skills are there in the team who needs to take the health impact assessment? And so on. So you have sets of questions which you look into, and then in the last column you can see the actions which have to be undertaken, like if in order to find out those answers, like you need to contact these stakeholders, and then in the scoping you have to define roles and connect with experts. And then the appraisal, you need to have document review and look at all those things. And then at the last stage, you need to communicate about the health impact assessment. That is what we see, that initially we started focusing on the physical environment, then we started looking at the exposure to chemicals, and now we have come to health impact assessment, where we look at the overall health of the community with respect to not just the chemical exposure, but also from the policy and kind of intervention or development projects that takes place. So that was about our one part. Now, moving on to another domain, we are going to look at the definitions and concepts. So here we'll see like what we really mean about health when we say health. So health, if you look at, is a complex and health can vary with the societies, with the context, and we cannot have a very uniform standard. So what might be considered in one country, the similar problems might not be considered in the other countries, or may not have the similar standards for the same health. And further, health is not just that you're ill or you're sick, but health also has a lot of meaning in terms of the physical strength, the mental strength, the social well-being. So all these is seen as health. So, and then just not your individual capabilities, but also your personal and environmental, economic and social factors, how they create the environment for health. So, if you look at healthy people, would be the people who are able to cope with everyday activities and to adapt to their surroundings. So in the diagram, you can see determinants of health ranging from individual lifestyles, which is influenced by social and community, and which further depends on the living and working conditions, which further influences the socioeconomic, cultural and environmental conditions. So you think of health condition in your city or in your village, think how it varies with in what conditions you live in, what is your age, what is your gender, culture, and what lifestyle you follow. So wherever you are, what the culture is, which condition you live in, that what is your health condition would vary a lot, and how do you see your health condition would also vary. So you look at the complexity involved and in the EIA process, the action that can be taken beforehand and the multidimensional factors one needs to look at. So you look at that complexity involved with health when we talk about health. So in order to put health impact assessments, like in order to really put it into practice, you need to consider both health outcomes, which means when we say health outcomes, it means specific type of illness and conditions such as infectious disease, the range of chronic disease, injuries, nutrition related conditions and mental well-being. And there's another term where you look at health determinants. So health determinants are factors that influence the experience of health in the affected communities. So when I'm ill, that's the outcome, but what kind of experience I go through because of that my illness in particular context is the health determinant. So that is how we understand health outcomes and health determinants, the difference between the two. So since the subject is complex, and it is also like you see how there are a lot of things, the context, the socio-economic, infrastructure, policy, all that would be influencing it. So there will be a lot of crossover, overlap among discipline, and you will need a lot of integration with the team. So when you have to do health impact assessment, you have to collaborate with people from different domains. So here in the diagram, you can see how EIA, social impact assessment and health impact assessment, there are so many domains which really overlap. So you can see how health can overlap with your environment of waste management, hazard material, air quality, soil quality, water quality, human rights, public services, working conditions, natural resource use and availability, ecosystem services. And then it would also overlap with social. You have like the public health, personal behavior, employment, demography, education, then also the environmental aspect, land and marine use, landscape, fishing and hunting, agriculture, indigenous people, energy and use. So you see how much the domain overlaps with each other. So what condition is there? What's the physical environment? What kind of impact it will have on health? What social environment is there? What kind of impact it will have? What it might lead to when any kind of impact happens. So as like it's frequently suggested that when you're doing health impact assessment, you can create one separate chapter for health impact assessment in the report. And the key idea is, irrespective how you make an independent report or you structure it within all the chapters, the key idea is that it should help the decision makers to look into the health aspects, so that you have to take care that the purpose is resolved. So while doing health impact assessment, you can give the information as the secondary effect of the environmental assessment also. So while you are discussing in form of matrix on human consumption of fish would appear in EIA section on fish and fish habitat. So it can also come out as a secondary impact as health. And then you can also express that, like if with the consumption as like indirect impact also, that can be shown. But while you take this kind of approach, you have one problem, that all the information, like you'll be putting across health information, so the health information will spread across the report. So when you do that, it will dilute the significance of any health related things, and any information done without the expert might also lead to diluted inferences. Like you might think that you might conclude that the impact would be negligible, whereas it might be significant when you see it in a collective form. So you can see that you can also provide a health impact assessment as a standalone document as part of EIA report also. So if you do this, you have the benefit of providing health information easily and facilitate discussion of health issues in a relation to one another. So that also you can do. Another approach which you can take is have a standalone HIA technical report. So the benefit of doing this is that all health issues can be completely evaluated. You may not be limited to the layout of EIA. So that benefit is there. But the drawback of this is that concerns of health maybe not, because it's a separate document, you might not receive considerable attention in the EIA process. And if you know that EIA has to be made public, then health impact might not be made public because it's not part of the EIA disclosure. So you can compose one chapter for a health impact assessment within EIA report. And the benefit is that it allows you to understand the health concern. It also becomes a part of the decision-making process. But that also has its limitation, that you might have to stick with the format of EIA. So mostly it is said that the first approach, where you spread across the chapter, or you can have one chapter as EIA is health impact assessment, is considered as very practically feasible option. So it's up to you or your team how you adopt. You can adopt any approach, but it is important that you maintain strong integration between the health and the other discipline while you're dealing with EIA. So it's good that you undertake integrated approach from the beginning of the assessment procedure itself, while you're gathering data, when you're doing analysis. So you look into all the aspects, so that all you have to take care of while you're doing health impact assessment along with EIA. So now let us see who all are considered while undertaking health impact assessment. There is a concept of inside the fence and outside the fence. So in case of health impact assessment, so far when we were looking at all other domain, we generally took the area where our project area was and with certain radius. But in case of health, you might have to look into whether you're going to look into the study area or out within the project area or outside that project area. So while looking at while undertaking health impact assessment looks into population who live, work, or play in the communities near to or potentially affected by the project outside the project area. So while we do our HIA, we really look outside the project area and not the people who are working for the project. That's a different domain altogether. But here you look at the people outside the project area and who are not involved in your project. So people who are dealing with the industries who are working, so occupational health and safety takes care of those aspects. But the practical challenge is that sometimes this inside-outside fence boundaries are not very clear in terms of how you will discriminate between them. For example, any interventions which you do for preventing malaria for workers might need large level area to work on. And also sexually transmitted infections can originate from inside the fence workforce. So the workforce which is inside can also infect with the sexually transmitted infections. So the idea under HIA is to evaluate what kind of impact will happen because of the proposed project on the local community. So now moving on, the next segment we'll look at the screening and scoping stage for health impact assessment. We see that a health impact assessment is also very parallel to EIA. So you have similar like screening, scoping, baseline, community profile, assessment, mitigation, enhancement, and monitoring. So in screening, you define if HIA is required or not, and then in the scoping, you plan out the how you're going to undertake health impact assessments, what all things will be covered, and then in the baseline data community profile, you gather data to understand the baseline health and environmental condition of the community. Then in the assessment, you identify impacts to health and distribution of effects. Then in the mitigation and enhancement, you develop strategies to minimize the health harm which your project will cause, no matter what kind of interventions you'll take, and then how you can maximize the health benefits, and then how you're going to monitor the effectiveness of health impact assessment and track changes over time. So that is what you will see here. So here we see what are the different approaches taken in the by International Finance Corporation and International Council of Mining and Metals. We'll see here. So they provide a framework for identifying health outcomes and health determinants. And so we see the two approach here. So here we are looking at health area categories, which is given by IFC. So here you see that they are defining with the health outcomes. So you can see the health area, vector related disease, and then such as malaria, schistosomiasis, dengue, and so on. And then you see respiratory and housing issues, or acute respiratory infections, pneumonia, tuberculosis, and so on. And you see veterinary medicine and zoonotic issues, sexually transmitted infections, soil and water sanitation related disease. So you see IFC identifies health concerns with health outcomes. Likewise, you see food and nutrition related issues, which are like stunting, wasting, anemia, micronutrients disease, change in agriculture and subsistence, hunting, fishing, gathering and practices, accidents and injuries. You can see health area where road traffic related spills and spills and releases. You will see construction and drowning will happen. So all these health impact you can see. The another area you can see exposure to potentially hazardous material, pesticides, fertilizer, road dust, and so on. Then you have social determinants of health, SDH, the psychological, social production of disease. Then you have cultural health practices, role of traditional medicine providers, indigenous medicines, and unique cultural health practices. So those categories are there. Then you also see health service infrastructure and capacity. Then you have non-communicable diseases. So that was from IFC. Now we're going to look at from categories provided by International Council on Mining and Metals. So here you see what are the health outcomes they identify. So here they look at the infectious disease, chronic disease, nutritional disorder, physical injury, mental health, and well-being. So there are examples also put for those health outcomes. And now they also provide guidelines for modifiable determinants of health. So you are looking at the health determinants. So the health determinants include individual and family, like their physiological condition, behavioral conditions, social economic circumstances. Like if you look at the physiological conditions like the vaccination status, what's the nutrition level, what's the behavioral aspects like the lifestyle and daily routine, physical activity, use of tobacco, alcohol, and so on. And socioeconomic circumstances like what's the income and wealth, what's the education and learning, employment and economy. And then you look at other environmental aspect, the physical, housing, how is the housing scenario, what's the transport, what's the exposure to chemicals, agriculture and food supply. And then you look at the associated other areas like you have determinants, social, which includes community infrastructure, crime and safety. Then you also have employment and economy. Then you also have institutions and policies which also influence. So institutions involving social care, what kind of care, what's the policy services, emergency services, how are they in any given context, and then the policies about governance, public policy, industrial health, what kind of policies there, how it controls the environment. So that's about when you do scoping, you also identify according to the different categories. So we saw how you have different categories based on the health outcomes and then also health determinants. So now moving on, we're going to look at the baseline community profiling. So when we do baseline, this is the third step we're looking at: screening, scoping, and baseline. So here, the key purpose is to develop a baseline profile, community profile, in order to categorize current conditions relevant to health for the affected people. So we set up what is the current health conditions. So for this purpose, the kind of information which you need is, like you look at the demographic information, what's the population size, what's the how is the age distribution, how is the gender distribution, and then you look at different information on the health outcomes, like what's the life expectancy, rates of specific disease, rate of injury, and so on. And then you look at health-related behavior, smoking, physical activity, and all. So the range what we saw that. So when you do the profiling, you look at all those aspects here. And then plus you also look at social, environmental, and institutional determinants, which we discussed about the housing, healthcare services, income, and education. So you also evaluate those aspects. So those aspects are seen here. So within health impact assessment, HIA, you prepare the community profile, and it has several purposes. Like it's helpful to you, it will help when you will do the community profiling. When you will prepare this profiling, it will help you to understand what is the nature of the population in that the area where you are studying, and what's the kind, the size, the distribution of it. Are people rich or poor? Do they have facilities or not? What kind of institutional and environment is there? And then the another key idea here is to you should be able to measure what kind of changes are happening, so that with your project you would be able to track that whether it's getting worse or it's improving, the health conditions are improving. So such kind of information, like all these information, is important for accurate prediction, and it's important for taking mitigation measures also. So you can take an appropriate mitigation measure depending on the context and what kind of impact is happening. And then all of these will also vary with the context. So you would understand a different country would have different social system, policy system, different industrial laws, and all those infrastructures. So their conditions would vary according to that. So it also helps us when we do this, we also understand the burden of disease. So when we say burden of disease, is like how much burden is there on any context, health care system, and how much it will be capable of taking care of those things. So we saw so much during the COVID time what kind of burden of the pandemic was there on the existing health infrastructure. So while you're looking at the burden of disease in any kind of population, you mostly look into the chronic conditions, like you also check whether what kind of burden is there, what is consuming most of the infrastructure and energy. So is it like hypertension or cancer, or they are basic problems which are large scale problems like mosquito borne illness, malaria, or it's a nutritional deficiency and so on. So you also need to understand the character of burden which is there on the system. So you also need to understand what kind of healthcare system is there in particular context, and this is very important for ensuring that the project does not worsen the current scenario, but it improves the health. And this particular community profiling also helps you to identify potentially vulnerable subsets, the group of people who are particularly vulnerable. So they can be infants, children, women, people with disability, people with food insecurity, and also different medical conditions. So it will help you to identify that. And then it will also help you to create a reference point to measure whether it's getting better or it's getting worse off. There's one which we saw is about the community profiling, but there's also idea about baseline. So if we see community profile as per the definition and the purpose, it's intended to create overall picture of the community's health. And it's created to help us understand the health context of the people who are going to get affected. And the other is the baseline. And this looks into like looking at very limited information, and you would be only monitoring in looking at the indicators over time, and look at what's really happening to those people. So in practice, we see that community profiling is mostly used. Another important point, which we have not seen in any other domain, is the ethical issues around health data collection. So whenever we deal with health data collections, we have to deal with the ethical issues, because there can be unique laws and issues which might come in, so which you have to abide by the contextual policies which are there. And you might, while collecting the data, might be interfering with the privacy and confidentiality of the people whom you are surveying. So most of the time, health-related data are very confidential and private, and data can be sensitive. And for example, there can be HIV-related information, even immunization-related information, which can be used for discriminating among individuals when they are hiring or traveling and so on. So such kind of information can be sensitive and can be used against them. So one needs to take care that it's not even accidentally released, and you need to have confidentiality undertaking, and you need to abide by all the legal aspects of it. you might have, in order to take care of this, you need to obtain ethics approval from whatever is the appropriate institution or government setup which is there in your context. Then you have to get the consent of the people, whether they want to participate in your survey or not. And then you have to ensure that you do not use the collected data for any other purpose apart from the purpose you have mentioned. And then you also do not collect anything extra than what you intend to analyze. And whenever you present health data, so you do not disclose individual data or community data, but you present only aggregate data. So always talk in terms of aggregate information, and you do not by any mistake show individual data. So you also take care of avoiding any kind of individual identifiers like what's the name, date of birth, and so on. So that has to be kept separate while you're dealing with it. So that was about the privacy and ethical issues about the health. So now moving on, we'll look at the assessments for health impact assessment. So when we deal with assessments, we collect information from various sources so that we can predict what kind of effect would happen from the project, what kind of health concerns will be raised.